Let's discuss about an autoimmune disorder called as POEMS, that is POEMS. And this condition is a paraneoplastic syndrome which is characterized by the monoclonal plasma cell disorder and also peripheral neuropathy and other features. And this condition has got a combination like polyradiculopathy and also plasma cell disorder. And let's look into the other features of POEMS. And this POEMS is often characterized by the high levels of VEGF, vascular endothelial growth factor, and also Castleman's disease. Abbreviation of POEMS. Here the P indicates the chronic inflammatory demyelinating polyneuropathy, and we all know that acute inflammatory demyelinating polyneuropathy is called as Guillain-Barré syndrome. But in case of POEMS, we find chronic inflammatory demyelinating polyneuropathy. And O means organomegaly, E is endocrinopathy, M is multiple myeloma, we call it as monoclonal gammopathy. Osteosclerotic lesions are seen in this condition, and this M, the multiple myeloma, is refracted to therapy, lambda chain, and S here is the skin changes, and this is about the POEMS. And this condition is also associated with elevated vascular endothelial growth factors and Castleman's disease. And what are the skin changes seen in case of POEM are the skin changes like hyperpigmentation, hypertrichosis, Raynaud's phenomena are the skin changes seen in case of POEMS. And what is the clinical features patient present with or the signs and symptoms seen in case of POEMS are, we find absence or diminished reflexes, painful dysesthesias or back pain, tremors are common, even we see the cranial nerve involvement, and also we find bulbar involvement, and autonomic symptom involvement in chronic inflammatory demyelinating polyneuropathy is generally mild and limited. Treatment available for this condition POEMS are the IV immunoglobulins, steroids and plasmapheresis. Thank you for watching.